Okay, let's jump right into this explainer. We're talking about urinary tract infections, or UTIs. It's a topic that affects literally millions of us every single year, but it's still somehow wrapped up in all this embarrassment and misinformation. Well, today we're ditching the myths. We're going to look straight at the science, the raw data, and the biology to figure out exactly what is going on inside your body.
We've got a lot of ground to cover today. We'll quickly run through what UTIs actually are, the usual microscopic culprits causing the trouble, who's most at risk, the red flag symptoms, how we diagnose and treat them, and finally, maybe most importantly, how you can stop them from happening in the first place.
So, starting right with the basics, what actually is a UTI?
Well, a UTI isn't just one specific thing. It's really a broad, umbrella term for a bacterial invasion happening absolutely anywhere along your urinary system. Now, your urinary tract is naturally designed to be a fortress. It's built to keep bacteria out. But when those biological walls are breached, bacteria can set up shop in the lower tract, like your urethra and bladder, or they can travel all the way up into the ureters and the kidneys.
And making that distinction is absolutely crucial. We have to separate a localized bladder infection, what doctors call cystitis, from a much more severe ascending kidney infection known as pyelonephritis. Look, a bladder infection is painful, it's super annoying, for sure, but it usually stays put. If those bacteria manage to travel further up into the kidneys, though, boom, it escalates into a totally systemic, potentially life-threatening emergency with fevers, severe back pain, and it often lands people right in the hospital.
Okay, so who are the common pathogens, the microscopic invaders we're actually dealing with?
Get this, one single bacteria is overwhelmingly the main villain here. Escherichia coli, or E. coli, accounts for a staggering 85 to 90% of all UTI cases. Think about that. The remaining 10 to 15% is a mix of other opportunistic bugs, like Klebsiella or Proteus, but the vast majority of the time, E. coli is the specific enemy we're fighting.
Now, you might be wondering, where on earth does all this E. coli even come from? Actually, it usually lives completely harmlessly right inside your own gut, helping you digest food. The trouble only kicks off when these bacteria decide to travel to the wrong neighborhood. They physically cross over from the rectal area, move to the periurethral area, and quickly travel up into the normally sterile urinary system. Once they stick to those bladder walls, they multiply like crazy, and suddenly, yep, you've got a full-blown infection.
Moving on to key risk factors, who is actually the most vulnerable here? Why is it that some people seem to get these things constantly, while others literally never do? Is it just terrible luck? Well, no. There are very real anatomical and behavioral triggers at play.
First off, women are at a major structural disadvantage because they have a much shorter urethra. It literally just means there's less physical distance for the bacteria to travel. But it's not just anatomy. Certain birth controls, specifically spermicides, can actually kill off your good protective bacteria. Plus, postmenopausal women experience a massive drop in estrogen, and that fundamentally weakens the natural defenses of the vaginal tissue. Add in something like using a catheter, or even just not emptying your bladder all the way, and you're basically rolling out the red carpet for bacteria.
But here is a truly surprising fact about men. UTIs are way less common in men, but when men do get them, doctors basically automatically classify them as complicated. Why? It's all about the prostate. The prostate gland can essentially harbor the infection-causing bacteria, making it incredibly stubborn and hard for standard antibiotics to wipe out. Plus, men dealing with a UTI usually have some underlying structural issue, like a blockage from an enlarged prostate or a kidney stone that sparked the whole thing to begin with.
We also can't overlook expectant mothers and young kids. Pregnancy brings on intense hormonal shifts that can cause urinary stasis. Basically, the urine sits there longer, giving bacteria ample time to throw a party and multiply. For kids, the toilet training years are just notoriously tricky, and there are conditions in infants, like vesicoureteral reflux, where urine actually flows backward toward the kidneys. Really, any kind of childhood bowel or bladder dysfunction heavily stacks the odds towards getting an infection.
All right, let's talk symptoms and serious complications. How do we recognize the signs early?
The classic alarm bells are usually pretty impossible to ignore. You're looking at a sharp, burning sensation when you pee, combined with this massive, relentless urge to go, even if you literally just went 5 minutes ago. You'll probably find yourself only passing tiny amounts of urine at a time, too. And definitely keep an eye out for changes in the urine itself. If it looks cloudy, red, bright pink, or, cola-colored, that means there's blood, and that is a huge warning sign. A heavy, aching pain in your pelvis or lower abdomen is another major red flag.
So, what if you just ignore those alarms? Well,
please don't. Things can escalate into some truly terrifying complications. We're talking permanent, irreversible kidney damage if the bacteria climb that high. In severe cases, the infection can breach your bloodstream and cause sepsis, which is absolutely life-threatening. For pregnant women, ignoring a UTI can trigger preterm birth or low birth weight. And for men, getting these repeatedly can lead to severe scarring and narrowing of the urethra.
Thankfully, we have diagnosis and treatment options. We have targeted solutions.
To fight back, doctors have to know exactly what they're up against. They usually start with a standard urine culture to see what bacteria actually grows. But modern medicine is pretty amazing now. For complex cases, like recurrent infections that just won't quit, or complicated cases in men, doctors can use next-generation sequencing. It literally maps the exact DNA of the pathogen directly from the urine sample, so absolutely nothing flies under the radar, even if the bug doesn't want to grow in a traditional lab culture.
The absolute gold standard for treatment? Targeted antibiotics. Depending on the exact bug they find, doctors usually deploy first-line defenders like nitrofurantoin or fosfomycin. Now, if you're a man or dealing with a complicated case, you're going to need a much longer course of those antibiotics to wipe out the stubborn bacteria. Also, postmenopausal women can see a huge benefit from topical vaginal estrogen, which brings back the natural flora to help fight off future invaders. And obviously, if things have escalated to the kidneys, you're looking at IV antibiotics in a hospital setting.
Let's get to the best part. Effective prevention strategies. How do we stop this cycle for good?
You're probably thinking, okay, but what can I actually do today at home to protect myself? Are there scientifically proven habits to keep your urinary tract completely secure?
Absolutely. And it starts with a rock-solid, step-by-step bathroom hygiene routine. I know it sounds incredibly basic, but this physically blocks bacteria from reaching the urethra. Step 1, always wash your hands thoroughly before you wipe so you aren't bringing in outside germs. Step 2, wipe strictly from front to back. You want to push any of those gut bacteria away from the sterile urinary tract toward the rectum. And step 3, one wipe only. Don't go back over the area with the same tissue or you're just dragging the germs right back to where you definitely don't want them.
Beyond bathroom habits, your everyday lifestyle choices are your ultimate biological shield. Aggressive hydration is a game changer. Try to drink 1.5 to 2 liters of fluid every single day to just keep flushing the system out. Make a point to empty your bladder completely every 4 hours. And this is a big one. Urinate promptly after sex to flush out any bacteria that might have gotten introduced. Also, throw out those germ-trapping shower loofahs, skip the bubble baths and irritating feminine sprays. Oh, and taking concentrated over-the-counter cranberry supplements? Studies showed they can actually stop bacteria from sticking to your bladder walls in the first place.
Like the old saying goes, it's always better to prevent an infection than to have to treat it. Proactive prevention, like drinking tons of water and staying on top of hygiene, is infinitely better than suffering through the pain and having to rely on reactive antibiotics, which, let's be honest, can lead to antibiotic resistance over time anyway.
So, I'll leave you with this final thought. UTIs are incredibly common, yes, but they're also highly preventable. Now that you know the hidden risks, the microscopic culprits, and the real-world remedies, will you recognize the warning signs early? Will you listen to what your body is trying to tell you before a minor annoyance spirals into a severe, life-threatening kidney infection? Stay hydrated, be proactive, and always take your health seriously. Thanks for joining me for this explainer.